you for the introduction. And thank you also to my colleagues who've made your time to be part of this session this evening. And I acknowledge the initiative from the facility, Dr. Alipate, Liz, and Dr. Nigel, in ensuring that the SOPs that are in place is not only made known at senior management level, but everyone to what's the point of that adhere to it as well. So at the end of the day, everyone is speaking the same language. At this point, I would like to acknowledge the presence of Sister Margaret Leong, Mrs. Margaret Leong, who's now currently the IPC advisor for SPC, and she is part of the IPC cell for IMT. So we'll be helping each other out on the session evening. So if you just give me time, let me just share the screen. So can everyone see this screen? Yes, no? Dr. Pate?
Yes, it's clear.
Okay, wonderful, all right. So as I've mentioned earlier, the webinar session this evening is specifically on the rational use of PPE and aligned to the standard operating procedures that we have. So, and the IPC cell, one of the roles and responsibilities that the IPC cell does on behalf of IMT and the ministry is to guide healthcare workers, not only within the health facilities, but also in the community isolation facilities, and also our private partners on IPC practices in the context of COVID. And this is one of the SOPs that the IPC cell was tasked to review. And if I could just say this evening that the SOP that we're looking at this evening is actually the third revision. Dr. Pate, I'm having problems in sharing. Probably someone is not allowing me to share this. Okay, yeah, I've got it.
Okay, cool.
Okay, so this is the third revision that we have, which was reviewed recently, following some recommendations from OSMED. Okay. So the recommendation from OSMED was actually a temporary amendment to the SOP, and this was specifically on the use of N95 masks. We're looking at the current Delta variant escalation in the Central Division. So the Alpha team, following their assessment, they had submitted a recommendation to the IPC cell and also to IMT and the task force on the need to change temporarily the use of surgical masks to N95 mask, specifically along the Lami-Suva Nosori corridor. But in consultation with the IPC cell, we saw that it would be ideal to have this practiced across all healthcare facilities and not just our facilities in the Central Division. So the SOP this evening, which Margaret is going to run through, and I'll be doing the last few slides, we look at the key initiatives, what initiatives we have in place to assist us in not only in the process of ordering or ensuring that our supplies are in stock in our facilities, and it will also give us some light on how we can assess our exposures and what level of PPEs we need to use at what point when we're looking after our cases, regardless whether they are positive, whether they are suspected, because right now in the Central Division, I can say that, everyone is positive unless you've proven through a swab test. Okay. So this current essay that we're going to share this evening is with the task force as an information paper, so that they could just have a look at what's being changed according to the recommendations from OSMED Alpha team. And I'll give the rest of the time now to Margaret. Margaret, over to you.
Thank you, Sarema, and thank you everyone for attending. Basically, the next few slides that I will be speaking on is extracted or uplifted directly from the SOP. So I'm not putting anything in this presentation on my own initiative, but it's been extracted from the Fiji SOP that we had the privilege to review and to update. The purpose of the SOP is really to ensure safety of healthcare workers, patients, and visitors on the use of PPE. Also to provide information about PPE use and when it's most appropriate, to provide guidance on the appropriate use of PPE and the selection that is required across all settings. And this includes also quarantine areas, and also to provide guidance as well to those who are distributing and managing the PPE. Next slide, Sarima. So the scope of this SOP, this is the template that the Ministry of Health uses. So we move on to the scope. So the scope covers all healthcare workers involved in COVID response, including our quarantine personnel. Also, any worker that's contracted, including other government department employees and volunteers involved in the COVID response. Moving on. To the next component of the template covers the mode of transmission. So we know from available evidence that the SARS-CoV-2 is transmitted through direct and indirect or close contact with infected people through infected secretions, respiratory droplets, which we already know that are expelled from infected when an infected person coughs, sneezes, or talks, or even sings. And we also know that airborne transmission can occur during aerosol generating procedures. So given the global pandemic that that we are all experiencing, with the increasing number of new cases globally, including Fiji and some of the other Pacific Island countries, in this context, PPE must be prioritized for healthcare workers to avoid shortages, which can also threaten, which can result in threatening healthcare workers' safety. Next slide, Sarema. Moving on to the next slide. Yeah, so basically every country needs a guidance on rational use of PPE. And this is because of the demand, the demand for PPE, the volume, the demand of PPE, and also based on the global shortages of PPE, this can lead to shortages of PPE at the frontline coalface, which can result in significant impact or the ability for healthcare workers to safely manage patients with COVID-19. Therefore, all healthcare workers must take responsibility to ensure that we have current stocks of PPE, that with our current stocks of PPE, that they are used appropriately, including now, we are into the extended use of PPE so that, adequate supplies can be made available to those working in high peak areas like in the Central Division. So the SOP highlights the protection also of all frontline healthcare workers through the prioritization of PPE for healthcare workers working in COVID centers. Next slide, Sarima. So section 5 of the SOP highlights the stand of the Ministry of Health in adopting these key strategies to optimize the availability of PPE. And this would look very familiar to you because they've been adapted from the WHO guidelines. Next slide. So this can easily be implemented. Some of these, we can all contribute to optimizing PPE use wherever we work. So this can easily be implemented by all of us ensuring that all staff are trained and assessed and competent in putting on and removing PPE. We also all of us need to ensure that we have a system of stock control in our own areas of work, that we are able to monitor our burn rates, and we are also following the SOP for cleaning and disinfecting some of the reusable PPE pieces, such as the goggles that are reusable. And also, we can also avoid wearing multiple layers of the same types of PPE. And also, we must not forget the value and the importance of hand hygiene as well. Next slide, please, Sarima. So this covers section 5.1 of the SOP. These are just some other simple measures to minimize the need for PPE that I know that you are already following and implementing in your different healthcare facilities. But I just want to stress that in the context of extended use of PPE, it is acceptable for that you can extend your use of PPE. It's perfectly acceptable for multiple patient encounters when you're providing continuous care. In a cohort of patients or to a cohort of patients with confirmed COVID-19. So extended use of PPE is very much applicable during widespread transmission of COVID. Next slide, Sarima. I think I'm coming towards the last few slides before I hand over to Sarima. So in section 5.2, it highlights the need to undertake risk assessment, which is a process really of evaluating. And I know that we are all well aware of risk management units, and we're always doing risk assessments. So the section 5.2 also highlights the need to always undertake risk assessment, which is basically a process to evaluate your likelihood of exposure to determine, what type of PPE you will put on to reduce the risk. So in the context of COVID-19 transmission, our risk assessment or your risk assessment should be based on whether you are able to do physical distancing or not. If you're going to have direct contact with a patient or the surrounding environment, and your risk of exposure to blood and body fluids, respiratory droplets, and of course, taking into consideration the contact, whether it's the transmission dynamics of COVID, whether you're going to be exposed to droplets or aerosol. And in this situation, you would be choosing, one of the transmission-based precautions, whether you're going to be using contact and droplet or airborne and contact precautions. Next slide. I think this is my last slide before Sarima takes back the presentation. So, to ensure monitoring and control of our PPE, now all requests, and I know this has been implemented, all requests for PPE is now being coordinated via IPC officers or IPC linked nurses. And for facilities that do not have IPCOs or IPC linked nurses, the requests are coordinated via the subdivisional nurse managers. And all PPEs are now, we have to have strict monitoring and controlling process. This is being currently managed at the central supply. So through distribution of PPE from the warehouse to you. So this has been put in place to avoid duplication of stock and ensure strict adherence to stock management and limit waste. wastage and overstock in some areas. Now I will hand over to Sarima to continue the presentation. Thank you.
Okay. With the SOPs, there are sections that we look at, and Margaret has talked about 5 of the sections of the SOP, and I believe the most important section that all of us are looking at or would like to get more clarifications on is on the type of PPEs that we need to wear and for which activity. Okay. So I hope Dr. Alipat and Liz would be able to share the SOP as we're sharing this in this webinar session. So in the section 6, it's actually looking at the process flowchart. So this is looking at the recommended PPEs that needs to be worn during this current outbreak, and according to the settings and the type of activities that you need to do or that you're going to do, and those who will be involved in that activity as well, in regards to care of positive or suspected cases. There are a few things that we need to keep in mind when we're looking at this table. I believe someone has got his or her mic on.
Yeah, you can continue now, sorry.
Thank you. So as I've mentioned, there are three things that we need to keep in mind when we're looking at this table, which I'm going to guide us through on the SOP. Now, the first one, as I had mentioned earlier in the beginning of the presentation, is that the N95 masks or equivalent must be used in all healthcare facilities by all healthcare workers or volunteers that are working there. So it's not only referring to our hospitals, but this is also referring to our community isolation centers. And you know what I'm talking about, or what I'm referring to. Okay? And this is in line to the recommendations that was put forward by the Alpha team because of the escalation of the Delta variant that we currently have in the country. Now, secondly, there's going to be questions that are raised. Now, what about the coveralls? Please bear in mind, keep in mind that we do not encourage the use of coveralls in managing of cases. However, there's provisions in the use of coveralls for our ambulance drivers. We had a chat about this with our Bravo team today. And I know that we're also providing this to our cleaners or to those who are handling our waste. But apart from those cadres or support services that we have, coveralls is not encouraged to be worn in the healthcare facilities. It's because of the high risk of contamination during doffing. Okay? And the third one that we need to be reminded about is hand hygiene. And we must not ever underestimate hand hygiene at any time. And this is where the 5 moments of hand hygiene comes in. So I hope we have not forgotten about the 5 moments, and we have our IPCOs who are listening in this webinar session. If this is forgotten in some of the facilities, maybe we need to remind them again on the 5 moments of hand hygiene. So your hand hygiene is not only emphasized during your donning and doffing of PPEs, but it is also emphasized when you're looking after your patients, so even before that. And this is where the 5 moments of hand hygiene comes in. I would like to take us to the SOP so that we can have a look at the table on section 6. And we'll just look at the process flowchart so that we'll be able to familiarize ourselves on the type of PPEs that needs to be worn, where, and by who. So I hope everyone can see this table that I'm sharing. Yes?
Yes, go ahead.
Okay. So on this table, you will notice that we started off with the healthcare facilities, and this is for inpatient. If we go down to the footnote on this particular page, it's written there that in addition to using the appropriate PPEs, frequent hand hygiene using the correct steps at the right time should always be performed, okay? And PPE should be discarded in an appropriate waste container after use. This is after your doffing, and hand hygiene must be performed before donning and doffing of your PPEs. So during your doffing, PPE doffing, after each doffing or after each removal of your PPEs, you must ensure that you sanitize your hands. And I would like to reiterate that because hand hygiene is important. And as I've said before, we cannot underestimate hand hygiene. And this is very important when we're talking about donning and especially doffing of PPEs. Now, secondly, as I've mentioned already, that coveralls is not required or should not be used when managing COVID-19 patients due to the high risk of contamination during doffing, okay? So if we go up the table under the healthcare facilities, you will notice in the COVID ward, you have your healthcare workers, you have your cleaners, and we also had a slight an inclusion in section 5, if I'm correct, on visitors. This was a discussion when we talked about visitors, and we were thinking about when the patient has a poor prognosis and the clinicians or those who are looking after that particular patient knows that this patient would not pull through because of the poor prognosis that he or she has. So maybe the patient would request if he or she could say goodbye to their relatives. So there's a provision on this particular section in section 5. However, we must take note that visitors are not allowed, only on special occasions. In such circumstances, on humanitarian ground, then you can make a decision on that. So in a COVID ward, you will see that everyone needs to wear N95 mask or equivalent. Okay. So before we had the surgical masks for cleaners and surgical masks for visitors if they would come in. However, this has been changed in the current SOP that we have. Everyone wears N95 mask regardless. Okay? And that also applies in our isolation unit. Okay? Or it's where we have our primary contacts or our suspected cases. Okay? So if you will notice on this table, under that section, your healthcare workers who are providing direct care to suspected patients, again, they need to wear N95 masks or respirators, and the use of eye shields, gown, and also gloves. Okay. And it's the same for our cleaners. So when they go in to clean the rooms, they will need to wear their full PPEs. And of course, the IPCOs or even the clinicians, as colleagues, IPC is everyone's responsibility. So we are here to help each other. And if you see one of your colleagues is not wearing the right footwear, open sandals or such footwear that would pose a risk to him or her, then they should be reminded, okay? They are foot covers that they can wear to protect their feet. Otherwise, they should be wearing appropriate footwears when they come to work. So again, in the healthcare facility, yes, go ahead.
Sorry, can you just increase the size of the...
Can you see that now? Can you see that now? Is that
just a bit smaller?
A bit smaller, okay. Apologies, colleagues.
Serena, sorry to interrupt. May I ask a question?
Yeah, go ahead, Dr. Nigel.
Serena, your fourth column refers to a gown. What's the difference between a gown and coverall?
Okay, it's basically the same, Dr. Nigel, and if that's a confusion, it's okay. Sorry, there's a difference between gown and coveralls. Okay, the coveralls, if we see, how can I explain this? So it's like a tracksuit that covers your whole body from your leg to head, or from your head to toe, with a zipper in the front.
Yes,
the gown has a tie at the back.
Okay, thank you for that, Sarima. Yes. Because I'm not from here, we call that hazmat, full bodysuit. So that's helpful. Thank you.
Yeah, we're used to using the term coveralls. So that's the difference between the two. Okay, you will notice that in the isolation units, the healthcare workers and the cleaners, they go in full PPEs, okay? And just a reminder to the healthcare workers, if you know that you will be conducting a procedure that would generate aerosols, or AGP, aerosol generating procedures, then you must ensure that you have an eye shield on, or a face protector to protect you, just because there is probably there could be splashes during the procedures. So the same in the triage area. For those in the triage area doing preliminary screening, but do not come in direct contact with the cases. So they need to wear N95 masks, and just ensure that they maintain their physical distance, and they need to perform hand hygiene after each patient that they see. So with patients who present to outpatient department with respiratory symptoms, we know that if they do not come with masks, then we can provide them with surgical masks. Now, most of them will be coming with fabric masks, and if they have respiratory symptoms, we need to change that fabric mask into a surgical mask. And again, maintaining our physical distance, and providing seats. And I've seen this has been practiced in all healthcare facilities, ensuring that there's a meter, 1.5 or 2 meters distance between two patients. So those patients without respiratory symptoms, a surgical mask is ideal for them, similar to the ones with the respiratory symptoms. Now with the cleaners in the triage area, as I've said before, and I'll continue to say, that they need to use the N95 masks. And it's a full PPE for them when they're going to do their cleaning. In the consultation room, you will notice the different cadres, or those who will be working in different areas. We have the healthcare workers there, patients with respiratory symptoms, and those that do not present with any respiratory symptoms, including the cleaners. On your fourth column, you have the different types of PPEs that they need to wear and when they're supposed to be wearing it. You will notice that we've provided, or we've given, surgical masks for patients, but for all those who are working in the healthcare facilities, they must be wearing N95 masks. Also applies in the waiting room. Again, this is in the healthcare facilities. So what about other areas that's off-patient transit, including the administrative areas, with the laboratory, x-rays and scans? The table spells out what they need to wear. And my apologies on the admin. Well, this is what's being recommended by the Bravo team in the administrative areas, because they do not come in contact with patients, and they're mostly in the office. So they can wear surgical masks. However, I would like to say this evening that since they are working in a healthcare facility, and upon discussion, again with the Bravo team a few days ago, everyone needs to wear N95 masks. So that particular column or row for the administrative areas will need to be changed, and they need to wear N95 masks. So with our laboratory teams, again, they go in full PPEs, and we have the X-ray scan, our lab techs. That's the PPE that they will be using, and they need to assess the risk exposure that they might be exposed to when they're looking after a patient, so they can evaluate and assess which type of PPE they would need to don when they're looking after a patient in this particular lab departments, in the radiology departments. Now, when it comes to the community, we should not be in the clinics. Our healthcare workers are doing N95 masks and need to maintain their physical distance. We see that most of them go in full PPEs. The shield, the gowns, the gloves. The use of N95 mask is ideal, but they need to maintain their physical distance. And the rest of the rows and the column spells out the type of PPEs that needs to be worn by each healthcare worker or the cleaner, and in which activity that they are involved in. So this is in the isolation area. We're talking about the community isolation areas. Again, the PPEs that they will wear is the same as those who are looking after patients in the healthcare facilities, isolation units. And there's no difference amongst those who are working in the community isolation areas to those that are working in the healthcare facility isolation units. And when it comes to our support services, the ambulance, the drivers and the attendants, they also have guidelines on the type of PPEs they need to wear. So for the healthcare workers, those who will be there to assist in transporting a suspected or confirmed case to a referral healthcare facility, they need to wear their full PPEs, N95, gloves, gown, and the face shield. There's something that I need to remind each and every one of us here this evening. Now, it's only the healthcare worker and the ambulance driver and the attendant or the assistant that goes in full PPEs. The patient does not need to be in full PPEs when he or she is transferred from one facility to another. I hope we understand that. Now, there's a practice that we've been seeing that even patients, they go in full PPEs. And I am one of them who had experienced this. Now, when we are when we're using our PPEs, we are protecting ourselves as healthcare workers. The patient only needs to wear surgical masks, and that's all. So I hope that's clear in this session this afternoon. And if there are some facilities or some centers that are providing full PPEs for patients during that transfer, I hope that's going to change after this webinar session this evening. So for the community response, when they go out doing mobile screenings, we encourage them to use N95 masks. There's no need to wear gowns or the use of gloves because they are encouraged to have their own hand sanitizers, and they are also reminded to frequently sanitize their hands when they're out in the community. So only those who will go in full PPEs are our trained healthcare workers who will be doing the swabbing. They will need to wear the full PPEs as what we've been talking about earlier on in the previous columns that we discussed. Now, one of the new inclusions that we've been requested by the task force to include in this SOP, and that was in the second edition, if I'm correct, was the inclusion of border and quarantine facilities. So in border and quarantine facilities, those staffs that are working there in the screening area, all they need to do is wear surgical masks and perform hand hygiene. So there's no need for them to go into full PPEs as the current practice or what we've been observing at times. The board and the quarantine staff, those who are doing first screening, they need to maintain the physical distance, the use of surgical masks, and again, the emphasis on hand hygiene at all times. Now, it's only the cleaner that will need to go into full PPEs. So they'll be wearing surgical masks, the use of gowns, the use of heavy duty gloves, because they'll be cleaning, not the disposable gloves that we've been providing to cleaners, having to use when they're cleaning the environment, whichever department or facility they've been assigned to clean. And when we look at the community isolation and quarantine, it's the same. So when they caring for suspected cases or confirmed cases, it's full PPEs. And that also goes for the cleaner. So in terms of ambulance or transfer vehicle, the PPE to one eyes, as what we had talked about earlier. And again, I would like to reiterate this evening, please, if there are centers that are providing PPEs for the patient to wear when they're being transferred, I hope that that's going to end after this webinar session. Because that's not also a guide that we have in our standard operating procedures. So the last slide that we have here, I'm not going to go back to look about section 7. It's talking about responsibility. So who is responsible? The SOE is known by everyone. So, and when we talk about those in authority, it's not those who are at national levels. Well, that's part of their responsibility. But when it comes down to the division or to the hospitals, if it reaches the medical superintendent or the director of nursing, this SOP or whatever SOPs that's being introduced needs to go down to those who are at the ground level, those who are actually doing the work. So they would know what they need to adhere to, especially in the use of rational use of PPEs, and that would guide them as well. Okay. So all line managers are responsible for ensuring that this SOP is adhered to at all times. So just like the other SOPs that we've been talking about from our other facilitators, okay, there is also a monitoring and review time for the SOPs. So for this particular one, it's being reviewed every 6 months, ideally. However, it can be reviewed earlier than that, depending on the changes and the current evidence practices that we receive from our teams and also from studies through WHO, CDC. We also revert to the guidelines from Australia. This will guide us when we need to review and update our SOPs. Thank you, colleagues. That's the session that we have for you this evening on the rational use of SOP. And I'm just going to try the last slide for those who might want to know, how do we calculate the stockpile of PPEs that we need to have so that we do not order less and we do not order more than what we need. So this is a calculation that we can use. The number of healthcare workers in a department or in a unit or in your isolation ward multiplied by the number of PPE sets times the estimated days in outbreak. And that will give you the estimate number of PPE sets that you need to stockpile. And always keep in mind that you, for the managers, you'll be aware of what's happening in your wards or in your departments. So it's always advisable that you add a buffer to your stock requests to avoid any shortages at any time. So that's an example that we have there. Say, for example, if you have 20 healthcare workers in your isolation unit, this is not only the doctors and the nurses, it also means the cleaners as well. So you will need to know how often they will be going in and whether it's necessary for them to go in as what Margaret has been discussing about earlier. So if you have 20 healthcare workers, then you will need to calculate how many PPE sets would they need in a particular shift. If it's a 12-hour shift, you need to calculate how many PPE sets they would need. And say, for example, if the estimated days of outbreak is 56 days, then you multiply that by 56, and that will give you the number of stockpile that you need to have at hand, or that you need to order if you're doing a projection on your orders of your PPE. The other thing I would like to remind everyone here, you know, there's some of us who are confused about the PPE sets, plus the ordering of individual gowns, N95 masks, and shoe covers. Now the PPE sets, most of us will be familiar that it has those, the N95 masks, the eye shields, the shoe covers. Now, if the PPE sets are not provided to you, what the warehouse will do is they will beef that up with the individual quantities or individual elements that they have to beef up the number of PPE sets that you need. And I hope everyone understands that. So if you do not get your PPE sets, the total number of PPE sets you need, please do not be discouraged, because what the warehouse does in consultation with Sister Colin, they will try and make sure that you get the number of gowns that you need, number of N95 masks that you need, so that you'll be able to look after your patients in a safe and quality manner. If anyone is wondering, okay, do we have enough PPE in stock? Yes, we have enough PPEs in stock. And I know that CWM has been provided with 2 containers, and that's being filled up with the assistance of the warehouse. And they also have a tracking and monitoring system in place that will help them to monitor the burn rates from each wards in the hospital. And that should also apply to the other health facilities. Please, you need to monitor your burn rates. Why do we need to monitor this? Some of us will say, is it important? Yes, it is important. It's important that this information is provided to our donor agencies, so that they would know, this is the number of PPEs that's being utilized at, sorry, I'm going to pick on CWM, that's going to be utilized at CWM. And it's not only for this current pandemic. I pray to God that it would not happen, but if there are future pandemics, at least we have records in place that will prepare us on the quantities of PPEs that we need, so that we do not run short or run out of PPEs. And we must also make sure that, you know, we need to think of worst case scenarios in the rainy days. This is why we need to adhere to the SOP of the rational use of PPE for our guidance, and also to assist us in providing quality and safe care to our patients. Thank you. Over to you, Dr. Alipate.
Thank you, Sister Serema, and thank you, Sister Margaret, for your presentation today. So colleagues, we'll start taking questions, and I can see that some have written some questions already in the chat. Can we just, we'll go through some of them. Sister Serema, there's been some questions at the IPC at CWM with regards to receiving different colored gowns. There's a yellow gown and there's a blue gown, and some staff prefer the blue one over the yellow one. Can you just comment, this is not the coveralls, these are just the usual slip-on gowns. What's the difference between the yellow one and the blue one? Is there a difference, and which one is recommended?
Thank you, Dr. Alipati, for that question. That's the same question that was raised today when I had accompanied the Bravo team to Valley Level Health Center. So the health center was asking which gown is safe to use in the context of COVID-19 response. There's no difference in the gowns, Dr. Alipate. Okay? Regardless whether it's yellow or blue, they are all safe to use. So if you are provided with the yellow gowns, you can use the yellow gown, or if you're provided with the blue ones, you can use that. So there's no difference between those gowns, Dr. Alipati. Thank you. I know there are preferences where we want to use the blue ones, because probably they look a bit thicker than the yellow ones. And we also have the light blue ones. However, they they play or the same purpose, and that's to protect us when we're looking after our patients. Thank you.
Vinaka Sista, some of the questions that are coming in on the chat forum tonight, what are the appropriate PPEs for, say, the vaccination teams, both the stationary vaccination teams and the mobile vaccination teams?
Thank you for that question again. I have Margaret, who can also provide assistance to the questions raised. The question, that's the same. Yeah, go ahead, Margaret. You want to answer that?
Sarima, I was going to suggest that you just leave the SOP on the shared screen so that you can scroll up and down between on them whilst you answer questions. And also that'll get people to know that, their questions would, they can always refer back to the SOP. I think the SOP covers vaccination. Thank you.
Thank you, Margaret. Yeah, for vaccination, I'm trying to pull up that document again. For vaccination, that was another question that was raised by the vaccination team today. There's no need to wear gloves. Again, we assess the exposure of risk when we're going out to vaccinate. Ideally, it's just the gown and the N95 mask. There's no need to wear eye shields, unless if the patient is going to cough a lot, and there could be risks of droplets or splashes, then there should be the use of shields. But ideally, when you're going out for vaccination, it's just the gown and N95 mask, plus the use of hand sanitizers after each patient, and no gloves.
Yeah, I'll just add on that, if in any case the nurse prefers to have gloves on, then she must remove the glove and hand hygiene before she puts on another pair of gloves. I think that's a message that needs to be stressed, that sometimes, when we wear gloves, we forget very easily that, we need to remove it between patients. So I've seen nurses not removing their gloves at all. And in a vaccination center, we know the volume of people coming in to vaccinate is quite high. So you're better off performing hand hygiene with the alcohol-based hand rub between patients, as opposed to having gloves on. But again, if you prefer to wear gloves, then it's your responsibility to ensure you change it between patients, between people coming in for vaccination. Over.
Thank you, sorry, Margaret. On that note, I've seen some SOPs, even some YouTube videos about people sterilizing the glove in between patients. So they're actually putting the alcohol onto the gloves and sort of sterilizing it with that. Would that be something that we would encourage?
No.
Yeah, thanks for that question, Dr. Alipate. The answer is no. So the reason why you cannot use alcohol on your gloves is because of the material that the gloves is made up of. The alcohol can you can get holes in the gloves, and therefore it becomes ineffective. So the answer is no. It's also documented in WHO guidance that you do not disinfect your gloves with it on, but you must remove it. Yeah, so it's not good practice. Thank you.
Okay, thank you for that. Okay, we've addressed quite a few questions. Okay, somebody's asking about heavy duty gloves. Is it reusable? I think this is for cleaners. Do our cleaners need to be provided with a new pair every time they... Margaret or Sarima, do you want to have a go at that question? And then we move to
heavy duty gloves are not disposable. They are reusable. So in the context of using heavy duty rubber gloves, then they should be washed and air dried. They're designed for reuse. That's why they're called heavy duty rubber gloves. Yeah, so they should be washed and air dried. Thank you.
Dr. Bibo, sorry, you can unmute yourself and ask your question.
Yes, thank you so much for the discussion and presentation. I wanted to know if hand sanitizing. Hello.
Diksha, can you off your mic, please?
Hello.
Sorry, Dr.
Yes, we can hear you.
Sorry, Dr. Bibo, I've just muted everyone. Just unmute yourself again, please.
Yeah, we're just considering for our SOPs for managing COVID patients in theaters. I was thinking of double-layered gloves, and I was considering during doffing to perform hand sanitizing over the glove before removing it. So is that I mean, obviously it's not going to be staying on. So just in the interest of reducing the viral load on your.
अनम्यूट कर दिया हल्ला सुना तेरा इतना
I don't know whether you get my point.
Sorry, Dr. Bibo, go again. Go on again.
Okay, sorry. Hopefully third time's a lucky charm, eh? So when I was writing the protocols for managing COVID patients in the theaters, we were thinking of double layers of gloves and PPE, so as gowns over your gown, your scrubs, obviously. But for your outer layer, as you're doffing it, would it be reasonable to perform hand sanitizing with alcohol-based gels on that before you remove it, in terms of reducing the viral load on your gloves? Because it's directly lifted from protocols from the UK. I just thought it might be useful here, but what do you think about that?
Yeah, I can go first in terms of answering Dr. Kenton. You know, in any case, if you're double gloving, the principles is the same. You must you know, prevent yourself from self-contamination. So basically, in this context, you are just using alcohol hand rub in the process of removing it is just to decrease you know, maybe the virus that could be the viral load, or you could be decreasing the blood content on your gloves. In that case, it's okay. I was meaning in the context of you know, using alcohol hand rub to disinfect your glove, to keep it on and to, you know, to use again for the next patient. But in this context that you're coming from, you are using the alcohol prior to removing that first layer of glove or second layer of glove. I'm not so sure. But in the context of alcohol hand rub, it's okay in where you're coming from. Yeah.
Thank you. Yeah, you've answered my question. Thanks.
Thank you, Nakabunwai. Thank you, Margaret. So a question here about healthcare workers getting allergic reactions to PPEs, specifically the yellow gowns. The question, I guess, is to everyone. Can you just give a thumbs up if you have had a reaction to the yellow gowns, and also has anyone have any issues with N95 masks? If they're getting allergic reactions to N95 masks. And sorry, to Sarima and Margaret, what do we do if we're getting healthcare workers that are getting allergic reactions to the PPEs?
Yeah, I can see Sarima is having some issues with her internet connection. So I will answer it. It's really, really difficult to wear N95 masks for long periods of time. It's well documented. And so in that situation, you know, it's really difficult. I guess then you may need to change it more frequently, as opposed to wearing it for, you know, a longer period of time. I mean, I personally couldn't wear it for at least 4 hours. You know, if we talking about the context of extended use of PPE. So with N95, you know, I salute you all, because it's really, really difficult to have on for a very long time. And so, you know, I really cannot answer anything. I cannot answer that question because I'm not the one in the front line. But it is, you know, as I had stated earlier, PPE is there for your safety, and initially N95 was not part of the SOP for non-aerosol. It was only indicated for aerosol generating procedures, but in the context of the Delta variant being very transmissible, the OSMAT team had recommended that it be used in all clinical settings in the central division only. So yeah, so it's, you know, I think you may need to seek advice from your manager, maybe be removed from COVID care. In terms, I know that there are allergies towards gloves, and so the response would be to use nitrile gloves. There's nitrile gloves. It's the latex in the gloves that cause the hypersensitivity. So you should be asking for nitrile gloves, and I'm sure that there's provisions for nitrile gloves through FPBS. I'm not aware of any allergy for gowns. So this is the first time I'm hearing this. Thank you. Those are my feedback.
Thank you very much. Someone has asked a very interesting question. Is there a time limit for the wearing of PPEs? There was some mention in the beginning about only 15-minute contact with COVID patients. Can we, I don't know if there's two different, okay, those are two different issues altogether, but I think it's important that we address that here.
Yeah, with you know, with if you're wearing the surgical mask for a cohort of patients and for extended use, you can keep it on for 4 hours, and it's advisable to change it when it becomes moist. You can wear N95 for up to 6 hours. You know, it depends on your you know, your condition, whether you are able to wear it for that long. But I would advise changing it up to after 4 hours or so. I hope that has answered your question.
Thank you. And what about the 15-minute attending to COVID patients in COVID wards?
I will leave that to Sarema to answer, because that's probably one of the, whether that's in another SOP, I'm not so sure. As far as I'm concerned, if you are in a COVID center and you are working within that environment, you may need to spend more than 15 minutes in the ward. you have the full PPE on, including N95, so you should be safe.
Thank you, Vinaka. Sorry, I think I saw someone with their hand up. Just unmute yourself and speak. Sorry, we have so many participants, I can't find you. But yeah, go ahead and ask your question. Unmute yourself and ask your question, Vinaka.
Well, it's actually not a question, but a contribution to the topic on allergy. We have 3 staffs in the division that has been brought to our attention that they are allergic to surgical and N95 mask. So what we are doing with these 3, they are putting the cloth mask underneath, and then they are wearing the other 2 masks over the cloth mask. Just to share that with the rest.
Yes, Vinaka, thank you for that. That's important. And maybe because I saw somebody mention about the yellow gowns, maybe wear another gown underneath that or something, and it might help. I don't know. But yeah, thank you for sharing that. Oh, a good one about double masking. Some people wearing a surgical mask under N95. The question is, does that break the seal? Thank you.
So, sorry, Dr. Patti, I'm back online.
Welcome.
Yeah, it's a bad weather this side, so my network is a bit down. Yeah. So with the use of the surgical masks underneath the N95 mask, you know, that's not a practice that we should be encouraging because that breaks the seal. So if you're using the N95 mask is ideal. There's no need to wear a surgical mask underneath that. I understand. I hope I heard correctly that there was some staffs who were having allergy reactions.
Yes.
Yes, yeah. So they can wear the fabric mask underneath, but must ensure that the N95 mask is over that. I believe that those who are using that practice has actually prevented them from those allergy reactions. However, we'll try and explore further on what are some other interventions we can use to keep our staff safe, especially to those who have allergy reactions. The use of the yellow gowns, if you're allergic to it, there are other gowns that are available that you can use as long as you keep yourself protected at all times.
Yeah, and I will just confirm that I've looked up the guidance on the WHO guidance on rational use of PPE. So in terms of extended use for your N95, you can use it without removal for up to 6 hours when caring for a cohort of patients with COVID-19. So there you go. I was right.
Margaret, thank you for that. Again, the question coming on foot covers, because the gown isn't long enough to cover part of the foot, whether that needs protection.
If we look at our, we've talked about the rational use of PPEs, the foot covers is included in the use of PPEs for those who are in isolation or who are in direct care of patients. So yes, you need to use your foot covers. But if this is a question that's driving towards the leeway of using coveralls or moon suits that I've seen before in the chats, we're not encouraging that. But the use of coveralls, yes. And there's the other thing about the use of hair nets. It is really not necessary for you to have head nets when you're wearing your PPE. So hair nets is not necessary. And that should be removed from our SOPs. Thank you.
Where was this one? Oh yeah. So there was a question asked as well earlier by the dentists, whether we have different sized N95 masks? Because some people have smaller faces and some people have bigger faces. Is that something that we have access to, or is it all one size fits all?
Thank you, Dr. Alipate. For now, it's a one size that fits all. However, we are looking at trying to get the sizes of N95 masks, because I understand of the different sizes that we have. Now, please take note that, you know, the PPEs that we're receiving, these are donated items. And again, I would like to acknowledge our donor agencies for their support and their assistance in strengthening this area. However, most of the PPEs that we're receiving is a one size fits all. And we're anticipating that we will get different sizes so that we will be able to wear these PPEs safely. I think that's one of the rules. That's one of the rules in PPE, that you must ensure that you have the right size PPEs before you look after your cases, so before you go into your isolation management. Thank you.
All right, Lisa, thank you, colleagues. I think we've gone well over time, but it's been a very good, fruitful discussion. Again, please leave your email addresses in the chat session, and we'll definitely contact you with the latest SOP for the rational use of PPEs. And oh, sorry, we've got a. Is it Margaret? Sorry, yeah, your hand is raised.
Yeah, yes, yeah, I just saw a very important question from Dr. Alicia on performing fit checks for when you're putting on your respirator mask or your N95 mask. This is very, very important. Using an N95 mask is very different from using a surgical mask. So it's important that you do a fit test. Now, Fiji doesn't, we haven't got the other gadget for testing. But what you can do is perform a fit check once you put on your N95 mask. So you can exhale once you have it on. Put your hands, both palms of your hands around the mask to feel for air. So when you exhale sharply, that'll create a positive pressure in the respirator, and you should not have any leakage. If you have, then you need to adjust the straps of the PPE. Maybe it's you know, overlapping or something like that, so try to fit it on. So you can do a positive seal check, or you can do a negative seal check. So to do a positive seal check, you exhale sharply, and the negative seal check is to inhale deeply, and you should have no leakage. If you have leakage, then you obviously have some you need to adjust your mask. So that's important. This information is also on the PPE putting on and removing poster that we have supplied to the Ministry of Health. Thank you. Sorry, I took a bit more time.
No worries, Sister Margaret. Thank you very much. So once again, colleagues, tomorrow we have same time, 6 to 7 p.m. Internal transfer of COVID patients. This is another very important one. And we'll have obviously discussions after this. So please place your emails in the chat forum. We'll try and contact you with the latest SOPs. Liz, do you want to say anything about updating of the SOPs on the website?
Thank you, Dr. Alipati, and thank you, Sister Sarima, Sister Margaret, for a great session. We will be, as I understand it, there may be a task force tomorrow. If not, it will be sometime next week, I imagine. And we are presenting SOPs for endorsement and request to put some of these up on the website. If not, we have your emails. Thank you for submitting those, and Sister Sarima's will circulate, I imagine, the PPE, rational use of PPE SOP to anyone that has put their email on this chat. Thank you.
Okay, thank you again to Sister Sarima, to Margaret Leong, and to everyone else. Have a good night, stay safe, and we'll see you again tomorrow.
Thank you, everyone.
you. Thank you. Good night.
Thank you, Dr. Pate.
Okay, good night.